Good afternoon. I'm James McCarroll. I am the Dean of the Skaggs School of Pharmacy and Pharmaceutical Sciences, and it is my pleasure to welcome the class of 2024 to their inaugural white coat ceremony. Now, as you know, because of the pandemic, you can't take a ship to Alaska, you can't take a ship to South America, but we do view our school like a ship, so you can come aboard. And when you come aboard, you're going to have an outstanding education. For the next 4 years as you embark, you will have the opportunity to become a primary healthcare provider with a degree as a doctor of pharmacy. You will be taught by an outstanding faculty. I think, as you know, every year, a member of our faculty not only wins a local teaching award, they win a campus-wide teaching award. So it's really very special. You will have a very unique and a very comprehensive education that will cover many aspects of healthcare as well as specifically pharmacy. Now, many of you, when you finish, will be pharmacists in the community. You'll be pharmacists in hospitals or clinics. But I know some of you will decide, I think I'm going to open my own pharmacy. Or you may want to start your own company for perhaps producing a new drug to treat many of the diseases that we have to face every day. On the other hand, some of you may decide you want to go into some aspect of public health, which of course today you read about all the time. So I just want to tell you that there are opportunities to do all of these things while you go through your 4 years. For example, there are workshops in entrepreneurship, meaning how do I start my pharmacy? How do I start my new company? What do I do first? How do I actually fill out the tax form for the state of California? So it really gets down to the nitty-gritty. You really learn those specifics. So that's available to you. The School of Public Health, which just started this year, has a wonderful program. It's called an Accelerated Masters in Public Health, which means that they recognize the first 2 years of your pharmacy school education toward a master's in public health. So if you look around the country, a master's in public health usually takes 2 years, but with this accelerated program, you can do it in 1 year. For those of you who are interested in research, as you know, it's really a mandate of our school that you will do a research project sometime during your 4 years. Now, some of you may decide you want to work in a basic research lab. Others, you might want to do epidemiologic research, or you might want to do clinical trials, or you might want to do clinical research deciding if a particular drug is actually effective in the situation that it's supposed to work. Well, you have the opportunity to do all of these things, all right? You can choose from a variety of research experiences. And those of you who think you might want to go into industry or biotech, well, this is a great opportunity because it'll look fabulous on your resume to say, hey, you know, I worked in a lab on this particular type of cancer and I learned all of this technology. This is something that's going to be available to you. So I really look forward to teaching you and to meeting with you in the next few years. I hope that pretty soon we'll actually get to meet face-to-face again. I've done this with classes in the past. You'll hear from them. You actually get lunch. Oh, wow, lunch. That's something new. And so hopefully this will begin for you pretty soon. We'll see. In any event, I will be teaching you in your anatomy lab in your first year. I will be lecturing to you in microbiology in your second year. And I will be in the audience when you do your presentations in the third year. So we'll have plenty of opportunities to see each other. So in summary, I just say, hey, welcome aboard and bon voyage. It's now my pleasure to introduce our guest speaker for this white coat ceremony, Dr. Jonathan Watanabe. Dr. Watanabe received his Doctor of Pharmacy degree from USC, and then he went to the University of Washington and got a PhD in many aspects of health economics, the social aspects of health, And that's what he's become very well known in. He is really known both at the state level and nationally as someone who advocates for pharmacy to congressmen and congresswomen. And he does this so well that he's actually been instrumental in getting very important pieces of legislation passed, which has broadened the scope of what a pharmacist can do. Obviously, because of this work, he's been recognized with numerous awards. Really, you can just go on the website and see them all. They're just too numerous to talk about. But he is really a leader in health economics. And the people at the University of Washington, where he did his PhD, they just say, oh, he's amazing. They recognize that he was just someone that comes along very infrequently. And I think something that you may not know is actually he will be teaching you this year. He's at the University of California, Irvine now, and he's associate dean there. But UC Irvine and UC San Diego are not that far apart, and because everything's virtual this year, of course, it's kind of easy to do a lecture. But this is going to be the beginning, I think, of an interface where our faculty will help teach students there, their faculty will help teach students here. And it's particularly fitting that he do this because, as some of you may know, he was on the faculty here at UC San Diego before he went to UC Irvine. So without further ado, Dr. Jonathan Watanabe.
Thank you, Dean McCarroll, and all of the faculty for this wonderful invitation to return to where I spent my past 7 years. I think about UCSD SSPPS fondly each day, and I like to start this presentation with a story. There was this 18-year-old guy who got into a university. His girlfriend enrolled in a different university that was 10 hours away by train, so he could only see her twice a year. On one of those long train trips, he started thinking about how much better it would be to have simple, high-quality video and phone calls to make it easy to talk to her. So he committed to working on it, and later on built the software to do it. That guy's name is Eric Yuan, the founder and CEO of Zoom. He chose to take a problem and make it an opportunity for good, so each of us can decide to make the world better because of a challenge. So I know these are really challenging times, but they may very well make this the greatest time to enter the pharmacy profession. From the New York Times article where ER physicians are talking about the critical role their fellow doctors of pharmacy play in taking care of COVID patients, to the CEO of the Kaiser Family Foundation stating that it will be pharmacies that will be key to vaccinating the population rather than the military, to an editorial I just wrote with Dr. Jan Hirsch about the key role community pharmacists will play in controlling flu and COVID this year, and that older adults often prefer going to their local pharmacy rather than having to go to a medical office. More and more people are describing the critical role pharmacists play. There are so many opportunities for each of you in the class of 2024 to be part of making the world actually stronger than it was before the pandemic. I just took off a mask and we're doing this virtually because we can't be in person, which I'd much prefer. So I'm well aware that we are on a global challenge. But this moment has also ignited progress in terms of technology and healthcare changes, resourceful thinking. For the good of our patients, it radically accelerated movement to virtual visits to a pharmacist. There are other benefits. Many families are spending more time together in ways they never could before you. You can now find good wine in cans, so you don't have to figure out how to finish a whole bottle by yourself. You can have a video with a cat sitting on your head without having to feed or clean one. This is huge stuff. As my friends can attest, it got me to become an avid hiker and to see things I would not have if my indoor gym would have been open. I've seen more waterfalls in a week than I saw in 20 years before that. So there really is a silver lining to this pandemic cloud. But to give you your first dose as a student pharmacist of cold reality, your future patients won't really feel sorry for you that you started during a pandemic. They'll just expect great care. Fortunately, you came to an incredible place that will make sure you can provide that care. You really do have the luxury of world-leading faculty, staff, and students at SSPPS and across the university and the community at large that can support you on your path. I often think about what I wish people told me when I was starting pharmacy school. And I'm probably about 2 feet away from your face right now if you're watching this from your laptop. So this is the one-on-one talk I wish I had. Set aside time to relax, reflect, unplug, and plan enriching things. It's been shown in countless studies to improve productivity and creativity and get you to think different about a challenge. I wish I would have tried to enjoy a lot more of my time in pharmacy school. I would have scheduled more time for friends that I now wish I spent more time with when I was in school. People come from all around the world to get to that beach over there that you can almost walk to by accident. So visit it safely with your mask on. When I think about what else you can think about in pharmacy school, make your own luck. What do I mean? It means to be optimistic and try more things. Mathematicians have studied this, and there are so many unknown variables that the best way to bolster luck is to keep looking for opportunities and trying new things. It's not magic, it's math. You're giving yourself more attempts for success. For you sports fans, it's giving yourself more shots on goal or giving yourself more at-bats to get a hit. I'm not going to lie to you, pharmacy school is really hard, but it's even harder if you don't look for all the positives you're fortunate to have. I mentioned earlier that pharmacists are one of the most important pieces in controlling this pandemic. Community pharmacists can provide care that is accessible and equitable. We're often the only connection to the healthcare system in poor, underserved neighborhoods or small rural towns. We're in a moment of so many challenges as we learn more about systemic racism that affects all minority groups, including those in healthcare. This isn't going to fix itself. It has to be challenged by each of us. I always say that the problem with racism is it imprisons everyone. It limits the perpetrator as well as the victim because it limits what all can accomplish and experience. Keep in mind, as a student pharmacist, you really are different than any other healthcare professional, legally. You actually are a licensed healthcare professional. Students in medical school and nursing school are medical students and nursing students. You are actually licensed intern pharmacists by the state. So the white coat you're about to don is going on a licensed professional. Take your role seriously and respectfully. Be generous to others. Find time to be grateful. Advocate for those that struggle to do it for themselves. Challenge your assumptions and your stereotypes and be positive. The population is rapidly aging. In 2035, there will be more people 65 and over than under 18 since ever. That's the first time in the developed world. Older adults take on average 8 medications each. They are the group with the largest proportion to get their vaccinations at pharmacies. They're also the group most at risk for COVID-19 and flu. There's a lot of work to do, and these people are actually insured by federal statute. Dr. Mimi Tarn and I, a family practice physician at UCLA, we work together a lot on looking at how we can improve care. She actually did a study where she measured how much time is spent discussing with a patient about a newly prescribed medication. It was 26 seconds. Less than half a minute isn't going to cut it when adverse drug events that put people in hospitals are measured between the 4th and 6th leading cause of death in the United States. But you guys can fix this with the training you will receive, and each one of you has a unique gift, and that's your advantage if you choose to be brave and apply it. Try to avoid pettiness and anger. It wastes time better spent enjoying life or getting something done. Nobody ever said, man, I wish I was mad at him longer. Keep things in perspective. My father and grandparents were among the more than 100,000 Americans of Japanese descent living in California who were illegally incarcerated by the government during World War II. So being stuck indoors with my awesome girlfriend is not too bad compared to what they contended with, and for many of you, what your parents had to overcome in their lifetime. That's not to say in any way that our current challenges aren't important. It's to say that others have come before us who have dealt with incredible setbacks and continue to succeed despite them. You've got toughness in your DNA. You will get through this. I'm trained as an outcomes researcher, which means I spend a lot of my time working with epidemiologists. We've now had documented cases of super spreaders infecting whole rooms of people. Turn that around and be a super spreader of positivity that starts change to others of optimism and goodwill. Make the world better than how you found it. It's still truly an honor for me each time I put on my white coat. I think you'll like it too. Welcome and congratulations to the class of 2024.
Hi, my name is Erin Yamanaka, and I'm the current president of the Association of Student Pharmacists and a P3 student in the class of 2022 here at Skaggs. On behalf of the students, staff, and faculty at the UCSD Skaggs School of Pharmacy and Pharmaceutical Sciences, I would like to extend a warm welcome to the class of 2024 and all of their friends and family watching today's ceremony. First and foremost, I would like to extend my warmest congratulations to the class of 2024. You all have worked so hard in order to get to where you are today and should be immensely proud of yourselves. Your determination and commitment to intellect has led you to starting one of the most important journeys of your life, becoming a future pharmacist. Today, as you receive your own white coat, this step represents not only all of your perseverance, but an opportunity to use your knowledge to educate and empower your future patients. 2.5 years ago, I got my acceptance letter from UCSD. Upon opening it, I was filled with immediate excitement, but within moments, I was drained of it. As quickly as I realized, it's happening! I also realized, it's happening. I was a pharmacy tech with a bachelor's degree, and now they're gonna trust me with maintaining public health? I had several thoughts. What if I give someone the wrong medication advice? What if I give someone the wrong medication? What if I stab someone with a needle and they accidentally bleed out? That was a thought that I really had. And those are all the thoughts I carried with me up until I sat in HSEC auditorium and listened to the various esteemed professionals and students speak, making it clear what commitment I was about to make. To never lose sight of my personal goals and aspirations, even when times are rough, to go the extra mile when it comes to providing optimal patient care and education, and to be the best version of myself, always acknowledging and reflecting on how much I have grown. By the time they called my name for me to receive my white coat, all my worries had begun to break away. It was made clear that I was with the right people at the right place to become the pharmacist I'd always dreamed I'd be when I first applied. I didn't need to be that person that day, and neither do you. You have the next 4 years to build those skills. Each time I wear my white coat, I'm humbled and reminded of that commitment I made. Knowing that my patients look to me for guidance has been truly gratifying and something that I do not take for granted. It makes all of the endless nights of studying for that next exam or balancing my time between extracurriculars like student organizations and volunteering at various community outreaches like the Student-Run Free Clinic, all worth it. In the moment, the combination of everything can absolutely feel overwhelming, but you will learn to meet the demands of the controlled chaos of Skaggs. Looking back on my own experiences with those hard times, those doubtful feelings of my ability to handle everything all seems trivial. And as you begin your first quarter here, I encourage you all to hold on to that thought, that you are capable of handling and accomplishing more than you think you can. And even if it seems impossible, you will get through it. Although there have been many stressful moments and challenges throughout pharmacy school, it is something that I've truly cherished and has been the highlight of my educational years. It has allowed me to grow both personally and professionally, and you will too. Further, my pharmacy school journey would not be the same if it were not for all the tight-knit relations that I've built with so many people here at Skaggs. The amazing staff, faculty, and preceptors are all your biggest cheerleaders, always there to guide you and support you. Not only are they the greatest resources of knowledge and insight, but they genuinely want you to succeed. And also your classmates, who will understand exactly what you are going through. They are the constant, unrelenting support system that will be there full-time, whether class is in session or not. But what makes Skaggs unique and ties in all these factors which help build a healthy professional lifestyle in pharmacy are the ample opportunities our school offers to get involved and find your niche. From research to clinical to leadership opportunities, you will find so many unique experiences to grow as individuals and to advance in your profession. I encourage you all to get involved so you can explore what you are truly passionate about. Before I let you all go, I would like to give some advice. First, be forgiving. Remember to always try your best in anything you do, but know your own limits. It's okay if you don't get honors in every single course or get that particular position you wanted so badly. And also, it's okay if your friends do. Everything really does happen for a reason, so don't blame yourself or others. Second, be adaptable. pharmacy school can feel like a delicate ecosystem of study, eat, and sleep. When things disrupt the flow, whether it's a career opportunity that falls through or a pandemic that changes your entire system of learning, don't lose sight of the larger picture. Being ready for change in whatever form it takes and however fast it comes at you is a vital life skill that will extend far beyond Skaggs. Lastly, be intentional. Keep an open mind about opportunities and don't close any doors that you haven't opened since you may not know what you want yet. The best way to get ahead is by knowing all your options before taking that next step forward. What matters most is that you believe in whatever that next step is and have a goal in mind. As you're reflecting on everyone's words of wisdom, remember how special this moment is. Like me, you applied to UCSD to learn how to have a profound impact on public health and your future patients. And you're starting at the right place. Wear your white coat proudly and let it revitalize you throughout these next 4 years. Let it give you the confidence that you're here for a reason. All of us here at Skaggs cannot wait to see all of the amazing things your class will accomplish. Again, from the entire Skaggs student body, congratulations and welcome to Skaggs. Thank you.
Hello, deans, faculty, staff, students, families, friends, significant others. My name is Candace Morello, and I'm Associate Dean for Student Affairs at UC San Diego Skaggs School of Pharmacy and Pharmaceutical Sciences. It is my pleasure to be here to introduce you to the class of 2024. The Office of Student Affairs and I have had a wonderful week with them during orientation. And even though my specialty area is in treating people with diabetes, we even focused on things like pies and layered cakes and other sweet things. And I'll let your students fill you in at home. So let's begin by talking a little bit about the class of 2024. They are comprised of 65 student pharmacists hand-selected from a very competitive applicant pool. 35% of them are male, 65% female. The average age is 23 with a range of 20 to 34. Every one of them has a bachelor's degree, and their GPA is very strong at 3.6. And you'll learn where they graduated from when I call their names. The sites range from Hawaii all the way to the East Coast, top and bottom, New York, all the way down to Florida. So let us begin with donning of the white coats. Mariam Ajmaya graduated from San Diego State University. Julia Albanez graduated from the University of California, Berkeley. Valence Oyoung graduated from the University of California, Irvine. Priscilla Bang graduated from the University of California, Los Angeles. Ahmad Bayasi graduated from Nevada State College. Mary Bamaya graduated from the University of California, San Diego. Caleb Brown graduated from the University of California, Santa Barbara. Justina Chang graduated from the University of California, Irvine. Alejandra Chavez graduated from the University of California, Riverside. Karen Chen graduated from the University of California, San Diego. Patrick Chen graduated from San Francisco State University. Vanessa Chow graduated from the University of California, Santa Barbara. Kevin Koh graduated from the University of California, Irvine. Eddie Deep graduated from California State University, Sacramento. Min Kon Nok Din graduated from the University of California, Davis. Kwa Duan graduated from the University of California, Davis. Yvonne Du graduated from the University of California, Irvine. Robert Garza graduated from the University of California, Santa Barbara. Jerica Gomez graduated from Chaminade University of Honolulu. Ryan Ha graduated from the University of California, Irvine. Elizabeth Haddad graduated from the University of California, Irvine. Charity Henrich graduated from the University of California, Irvine. Tram Huang graduated from the University of California, Irvine. Janice Huang graduated from Brooklyn College. Lisa Hoare graduated from California State Polytech University, Pomona. Cynthia Quinn graduated from the University of California, Los Angeles. Parker Kaleo graduated from the University of Florida. Stephen Kang graduated from the University of California, Los Angeles. Jennifer Kim graduated from the University of California, Los Angeles. Lauren Kuo graduated from the University of California, Davis. Melanie Kwok graduated from the University of California, San Diego. Hien Lei graduated from the University of California, Los Angeles. Thuyen Lei graduated from California State University, Fullerton. Ji-hyun Lee graduated from the University of California, San Diego. Laura Lucero graduated from the University of California, Irvine. Joseph Lee graduated from the University of California, Irvine. Renoj Matthew graduated from the University of California, Riverside. Evelyn Mendoza graduated from California State University, Bakersfield. Alamar Moore graduated from Rowan University. Stephanie Morioka graduated from the University of California, San Diego. Harut Nazarin graduated from the University of California, Berkeley. Isabel No graduated from the University of California, Irvine. Kenny No graduated from the University of California, San Diego. Destiny Nguyen graduated from the University of California, San Diego. Isabel Nguyen graduated from the University of California, Irvine. Rosalind Nguyen graduated from California State University, San Marcos. Luis Odisho graduated from San Diego State University. Montana Panic will graduate from the University of California, San Diego after her first year of her PharmD program, as she is in the BS PharmD program. Genevieve Pham graduated from California State University, Fullerton. Lauren Reynolds graduated from the University of California, Davis. Michael Sheeposh graduated from the University of California, Davis. Dan Angelo Sardilla graduated from the University of California, San Diego. Kenneth Taw graduated from the University of California, Irvine. Miriam Toma graduated from San Diego State University. Feng Queen Tran graduated from the University of California, Irvine. Joanne Transon graduated from San Jose State University. Thomas Vienne graduated from the University of California, Irvine. Cheng Yu Wang graduated from the University of California, Irvine. Jackson Wang graduated from the University of California, Davis. Camilla Wu graduated from the University of California, San Diego. Caroline Zhang graduated from California State University, Stanislaus. Olivia Yip graduated from the University of California, Los Angeles. Alice Yuan graduated from the University of California, San Diego. Christopher Zhang graduated from the University of California, Los Angeles. All right, that was really special. And now that everybody has their white coats, let's recite the oath of a pharmacist.
I promise to devote myself.
I promise to devote myself.
I promise to devote myself.
I promise to devote myself
to a lifetime of service to others.
To a lifetime of service to others.
To a lifetime of service to others.
Through the profession of pharmacy.
Through the profession of pharmacy.
Through the profession of pharmacy.
In fulfilling this vow.
In fulfilling this vow.
In fulfilling this vow.
I will consider the welfare of humanity
and relief of suffering
my primary concerns.
My primary concerns.
My primary concerns.
I will apply my knowledge,
experience, and skills
to the best of my ability.
To the best of my ability.
To assure optimal outcomes.
For my patients.
For my patients.
For my patients.
I will respect and protect.
I will respect and protect
all personal and health information
entrusted to me.
Entrusted to me.
I will accept the lifelong obligation.
I will accept the lifelong obligation.
Improve my professional knowledge and competence.
Improve my professional knowledge and competence.
To improve my professional knowledge and competence.
I will hold myself and my colleagues
to the highest principles.
To the highest principles.
The highest principle
of our profession's moral,
ethical, and legal conduct.
I will embrace and advocate changes.
I will embrace and advocate changes.
I will embrace and advocate changes
that improve patient care.
That improve patient care.
That improve patient care.
I will utilize my knowledge, skills,
experiences, and values to prepare
the next generation of pharmacists.
The next generation of pharmacists.
The next generation of pharmacists.
I take these vows voluntarily.
I take these vows voluntarily.
I take these vows voluntarily.
I take these vows voluntarily
with the full realization
of the responsibility with
the responsibility with which I am entrusted.
With which I am entrusted.
With which I am entrusted by the public.
That was really special, and the best way we could do it in this pandemic. Congratulations to the class of 2024 on joining the profession of pharmacy. In closing, everyone at SSPPS would like to thank you, the families and friends, significant others, for entrusting your students to us. We are thrilled for them to join our Skaggs family. We cannot wait to see what each of you will do, class of 2024, and all of your accomplishments as you sail through your 4 years here at Skaggs and all far beyond.